At Sersense, we are a company developing point-of-care solutions for detection of biomarkers in small volumes of samples. Our technology is based on microfluidic technologies that combine electrochemistry, analytical assays, and engineering that will be used for on-site testing. We're currently developing two different point-of-care systems. The first one is a system that will be used for detection of neonatal biomarkers in the small volumes of blood. Every year, like 15,000 babies are born preterm in the US. These babies need to be tested for different diseases just to make sure that they are healthy. So this tool is going to take a tiny amount of blood from babies, it's going to put it inside the device, and then it's going to analyze 3 different biomarkers to be able to detect if the baby has hypoglycemia, infections, or jaundice. The second technology is for detection of preclampsia. So for this tool, what we're doing is we're developing a system that will use unprocessed urine samples from pregnant women. We will take them into our system, analyze them, detect 2 key biomarkers, and with this, we will be able to determine if the patient is at risk of preeclampsia.
For someone that's been involved with SBIR for 30 years, I always thought, back in the 90s and early 2000s, that most of the awards were taking place in Minneapolis, St. Paul. And yet we have this amazing medical institution in Rochester, Mayo Clinic. We have an untapped opportunity with all the talent and technologies in Rochester. We now have a handful of companies that have not only started but secured SBIR and STTR funding. And Sersense certainly is one of them, but they also continue to collaborate with Mayo Clinic. And this is a real opportunity because we talk about the spillover effect around a major research institution like the University of Minnesota or Mayo Clinic. We have these amazing institutions in our state that can really be that, and they are the economic engine in many ways. But when it comes to translating technologies and commercializing technologies and into new products and services based on that research, that's really important, has long-term impact.
I am a scientist myself, so thinking about putting a company together is not something that was in my head, to be honest. MNSBIR has a large catalog of resources for entrepreneurs or innovators. Something that we don't know how to do is to translate this into products and how to become a company. So all of these resources are available. If it's writing a grant, if it's building your network, if it's getting partners, MNSBIR is the best ally you can get. Currently, these awards have helped us create jobs and also bring funds to the state. With these funds, we were able to hire a CFO and also to look forward for another research engineer that we just hired, and it's coming to the company very soon. But more importantly, we believe that after our technologies are developed, this is going to help improve the quality of life for patients.